Lawrence Memorial Hospital now brings you better health.
Postmenopausal bleeding is any vaginal bleeding that has occurred after the menopausal transition. So typically that's defined as 1 year without menses. So say for example you have a woman whose last period was at age 52, and at age 57 or 58 she has some spotting. And maybe the next month she has some spotting, and maybe 3 months later she has some spotting. And oftentimes those women will call their friends or their daughters and say, you know, the funniest thing happened, I got a period. Vaginal bleeding, and especially if it's not heavy, doesn't scare us as women. We bleed for approximately 30 years of our life every single month. So when it happens in the menopause years, you know, we're not concerned with it. And the important thing, it's very important to get worked up because that can be the first sign of endometrial cancer. So while not all episodes of postmenopausal bleeding are caused by endometrial cancer, most often a woman who has endometrial cancer will first present with postmenopausal bleeding. So I often see women referred to me by their primary care doctors, you know, because they are not concerned about it. They happen to mention it in passing, and the primary care doctors are smart enough to say, whoa, I think we should have that worked up by a gynecologist. Most commonly, I'd say when I do see a postmenopausal woman, she has a cervical polyp and it's benign, but that is what caused her bleeding. But it sure does make people, including myself, feel better to know that that's all it was. So there's lots of other things. So as I said, not everything that is postmenopausal bleed is a cancer, but the cancer is certainly the most important thing to rule out. And fortunately, endometrial cancers is one of those malignancies that if it's caught very early, the 5-year life expectancy is excellent. It's got a very, very good prognosis.